So we're exploring the impact of mis and also disinformation today. My name's Elizabeth Devaney and I'm the CEO of the Consumers Health Forum of Australia, and I'm going to be hosting today's webinar. As usual, the webinar will be recorded and then we'll pop it up on our YouTube channel. So if you want to watch it again and again and again, you can. A little reminder for anyone, we don't allow AI scribes in the chat. If you've got one, unless you need it for accessibility reasons and you've talked to us about it, we will boot it out. So just letting you know. Now, I'm joining you today from Naarm, so the land of the Wurundjeri people of the Eastern Kulin Nation, and I'd like to pay my respects to their elders past and present, and also acknowledge their continuing relationship to the land that we're on. Here at CHF, we start not only acknowledging the traditional owners of the land, but also the importance of consumer work in so many different ways in our sector. So we have a lived experience recognition statement, and you can see it here on your screen. And I'm just going to stop and give you a moment to read that. Great. This is really important to us. Every person has the right to be treated well and be able to access essential healthcare, and that's why CHF and our many member organisations are here, making sure as best we can to ensure those people making decisions about healthcare know what the community really wants. If you're not familiar with CHF, this is our 40th birthday year, which is great, and we are the National Consumers Peak Body for Australian Consumer Organisations Peak Body. That means we've got about 80 different organisations who are our members, and I'm sure some people from our members are here today, so hello to all of you. And we work to make sure that healthcare is safe and fair and really shaped by the people who are using the system. We're an independent organisation, so we have a board. We're funded by government and sometimes by universities and other organisations, but we're independent from government. We think that's important, and if you follow us, you'll note we're regularly critical of governments of all colours because we report what the community wants, and that I'm really very strong in this saying nothing about us without us. So we're thanks for the happy birthday, Saba. We live at a time now, really, where health information is at our fingertips. We don't suffer from maybe not having information, but there is definitely more than we can absorb. There's lots of information. We can find information really quickly about all kinds of things, whether we're using ChatGPT, we're Googling it, we're going to Google Scholar even, anywhere we want to go, we can find information really easily. However, the access, while it might be empowering, it also presents a lot of challenges because some of the information that's available online is not the same as when I went to school and I went to the school library and there were books there and I pull out a book and I get information and the school had checked that that was a good quality resource and I was comfortable that the people who had written the book knew what they were talking about. Now anyone, even me, can put something on the internet which may not at all be accurate, it may not even be safe, and you might read it and follow my instructions, and that could be very dangerous for you. I think Australians are increasingly aware of this. Every week, the media is reporting some other aspect of unsafe activity occurring that's virtual. And people really need access to good information. So our intention today is not to alarm people, though of course you may go away thinking, oh wow, I hadn't thought about that, but rather to give you more information, so that you can look for information online more carefully and be able to continue to be active in seeking information so you can make informed decisions. So we're going to talk about misinformation and disinformation, what they are, and how you can assess information so that it helps you make good decisions based on information you found. Of course, this is not an Australian issue, it's a global issue. Countries around the world are all challenged by this and grappling with it in different ways. So whatever we do here should be, of course, aligned with things that people are doing other places. I'm a big fan of not reinventing the wheel. So if there's something great happening in another country, we should be learning from that. But we do need to understand the landscape, know what's trustworthy, how to tell, what the questions are we should ask, what we should look for in order to know if this is really useful information or perhaps information we should ignore. We're hoping you leave today with clarity, with confidence, and some practical skills. That's the plan. So to start off with, we thought we'd run a poll and just ask you a little bit about the topic for today, which is mis and disinformation. So in a moment, someone will pop a poll up on the screen and you can vote. And we show you the results of the polls. We're going to have a few of them during the session. So this first one really asks you about misinformation and disinformation and says, do you understand the difference between these? How do you think about them? So everyone can vote, not me, but you can all vote. So just give you a moment to have a think, read those questions and then answer. Great. Can we pull up the results of the poll now? Yay. So some people saying, yes, I understand the difference. Other people not really sure. And some, I think I understand. What we're hoping, of course, is that at the end of this session, that you'll have a much better idea for those of you that didn't vote, that I clearly understand. So everyone else, we're hoping at the end that you'll feel more confident about knowing what the difference is. So now, these webinars, if you've never been to one of our webinars before, we try to have them as interactive as possible. And we'd love you to start off by thinking about what's in the chat and using the chat to ask questions and share information with friends and colleagues. I've got a little slide here about Zoom. If you've never used Zoom before, there are lots of things you can do. We're going to try them in a moment. You can ask in the chat if you've got a question. The amazing CHF team are there will help you. If something's not working, let them know. If the thing that's not working means you can't get into the chat, if you send an email to our admin email address, which is admin@chf.org.au, we'll be monitoring that live because maybe the chat is the thing that's not working, so you can't say, please help me. We love to hear your questions, and we have a Q&A session at the end of this webinar. So if you've got questions now or as people present, put them in there because then we will keep a record of that, and at the end, we'll ask them. Sometimes what happens is people are a bit slow to ask their questions, and we get to the end, and there's a lot of questions, and perhaps yours will miss out. But don't worry if it does, because we collate the questions. Sometimes after the webinar, we can send out information or include it in a social media post or in our newsletter. And your questions help us understand what's important to you, and then we use those to help format our advocacy campaigns and so on. So no question is ever wasted, but we may not get to your question today, which is why I really encourage you to put it down early so that we can get started on it early. Now, I thought we might try a couple of things here. First of all, there's a chat. So we're going to ask everyone, there's 78 of us, so 78 responses in the chat we're looking for now to introduce themselves. So we love you to say hi. We love to know your name and also your pronouns. So if you do put a question in your chat, we know how to respectfully respond to that. We'd like to know where you are. I said I'm in Nam. If you know what country you're on, do tell us. We love to know where you are all around Australia. It's fun to see that. And also, if you're with a member organisation or you're representing somebody else, we love to know that too. So this is a moment to share and just say hello to everyone. So I'll give you a moment just to type in, say hi to everyone, introduce yourself, where you're from, that kind of stuff. Thanks, Saba. You started us off. Fantastic. Thanks, Leanne. Often when we do this, people go, "Oh, I know you." And there's a moment of recognition, which is lovely too. You might be a long way away, but you might realize you know someone from some other time before. Hi, Beck. Not too early in the morning for Perth, hopefully, and you too, Anne. It's a decent hour if you're on the other side of the country. Oh, and someone else from Perth too, Keith. We've got a lot of folks from the other side of. Oh, and Pam. We've got the whole WA mob here. Big welcome to you all. I'll just give you another moment to pop your name and say hello to everyone. Remember to pop your pronouns too, because that's super helpful. Sometimes people's names, even it doesn't make it obvious to me what gender they might be, so that's or how they like to represent themselves. That's really helpful. Someone from Ghana country, Dill, Di too. I don't know if we've got any other people from Ghana country I didn't notice, but welcome. Oh yes, we do. Anne. Hey Anne. Well, South Australia, maybe not Ghana country. Welcome to you too. So the other thing we're going to do is if you look at the bottom of your screen, there's a react button. And if you press on that, you'll see that there are a whole lot of reactions you can have. You can send all kinds of effects. So I want you to just play with the buttons now. Just press as many as you can, look at what they do and get used to them because we're going to use them during the session. So we should in a moment have a stream of 70, 80, 250 different things go floating up there into the sky. Try every single button. I'm not seeing too many rockets yet or a few hearts, not too many surprised faces yet. Try them all, see what they look like. And during the sessions, as people are talking, if you like what they're saying, this is what we want you to do. Press the button. I agree with you. Thumbs up. Round of applause for someone makes a great point. Party if you support something. Something gives you a surprise. You didn't realize something. Use a shocked face. That really helps the people who are talking because they can't see you. They're not getting any feedback. They're not knowing if you're enjoying it or if you agree with them. So using these is a really simple way to do that. We'll also be able to use the chat too. So you can be popping things in the chat as well, saying, great point, love that. And I've got another idea. Often people put in links, share stories, do all kinds of things in the chat so that you feel like you're part of the conversation. Okay, so let's move on now. I'm going to start by defining what we mean when we say mis and disinformation. And then we've got some speakers who I'll introduce shortly. So, and now we've got someone's screen. I don't know whose screen it is there. Whose screen are we sharing? Somebody's. Oh, it's gone. Great. So at CHF, we often look at the World Health Organization for definitions. So these are their definitions for mis and disinformation. So the difference that they would describe to those two terms is misinformation is when information spread, but no one's doing it in a harmful way or a spiteful way. Sometimes people believe that information is true or interesting or useful, the kind of stuff you might look at, I don't know, on your Instagram feed or, Facebook. The person who sends it to you doesn't realize it's out of date or wrong. Sometimes people send you links saying, there's this great free thing or cut and paste this and, like the modern day mail, letters. And then there's disinformation. Now, that is a different thing in the sense that here we think, the way we describe it is people know it's harmful, know that it's wrong, and they're sending it around anyway. So maybe that person's going to make money out of you believing something. Maybe they have an ideological view, political, religious, something that they're trying to push. And so they want to tell you something about someone or something. So that's really the difference. Both of them can be dangerous, of course. So when we're talking about it today, that's how we'll be separating it out. So the misinformation, sharing things that might mislead, the disinformation, sharing things that not only might mislead, but is done intentionally. So now we're going to go to our second poll question, which is asking, what do you think the bigger threat is? misinformation or disinformation? So in a moment, we'll pop a poll up there. Now you've got a better sense of the difference. What do you think the biggest threat is? Again, I'll just give you a moment to think about the question and vote, and then we'll share the responses. So Joe just asked for an example. So an example for me would be, I don't know, my auntie put something on the internet to say that it's a really good idea if you have 3 spoons of sugar every morning because her neighbour told her you should do it and it'll give you energy all day. Now, for some people, 3 teaspoons of refined sugar every day, they had diabetes, for example, could really upset their balance, and just we're encouraging people to eat less refined sugar, not more. She's not meaning to hurt me. She's heard from someone it's a really good thing to do. Disinformation might be someone who's selling sugar and starts putting what look like testimonials from people saying, I started taking sugar every day and I've never felt better in my life. Click here and we'll send you cheap sugar. So that's a different story. That's where the person knows what they're telling you is not correct and harmful. But in this case, they're telling you because they're hoping you'll buy something from them, something they know is of little value to you. But of course, is big value to them because they're going to make money out of you. So think about it that way. I like to assume positive intent all the time. When anyone asks me something, I like to assume they're trying to help. And so when someone tells me something, my first thought is, oh, that's interesting. It's good to be curious, but then be a bit more curious. Why? Why are you telling me this interesting thing? Going that next step and being curious is really important to keep yourself safe. So how did our second poll results go? What do people think? Okay, good. So most of us think they're about the same. Both of them can be causing problems. Some people felt disinformation was more of a danger than misinformation. It's interesting. And thank you everyone for voting in the poll. So now I had the honour to introduce our consumer commentator. We have a consumer chair commentator on these presentations, and today it's Di Spillane. And we'll pop Di's bio in the chat shortly, but Di is a experienced Australian health consumer who uses her lived experience of a late diagnosis of narcolepsy to advocate for better consumer outcomes and also diagnostic standards. So we're really grateful to have you here today, Di, and it'd be lovely to just hear a little bit from you about your lived experience and your reflections on the topic. Thank you.
Hello, everyone. I'm Di Spillane, and part of the reason why I became involved in being a Consumer Health Forum member is due to the fact that I received a very late diagnosis of narcolepsy when I was 49, despite the fact that I had actually been experiencing symptoms of narcolepsy from childhood. So around about 8, 9 are about my earliest memories of that. And misinformation had played quite a big role in the delay to my diagnosis because I never would have thought in a million years that I had narcolepsy if I were to go by what I had seen interpreted in Hollywood movies and series and that sort of thing. Narcolepsy is always shown as being quite a funny thing where people just randomly fall on the ground, or, they'll be laughing and, they'll just land face first into a plate of food or something like that. It's always these really hilarious situations. And when it was first eventually suggested that I might have narcolepsy, and I was sent to be tested. So that involved an overnight sleep study, followed by the next day a multiple sleep latency test, which is a series of naps, 5 naps scheduled every 2 hours. And during those naps, they look to see how long it takes you to fall asleep, one thing. And when you do fall asleep, how long it takes if you even enter into REM sleep. Now, entering into REM during the day isn't common unless, of course, you're a sleep worker or something, or you've got other health conditions that may be contributing to that temporarily. But for people like myself, I can fall asleep during the day and be dreaming even as I'm falling asleep during the day. So, yeah, so they did the testing, but I nearly didn't stay for that multiple sleep latency test after doing the overnight sleep study because I was adamant that I didn't have narcolepsy. Thankfully, the technicians in the clinic convinced me to stay. Otherwise, who knows, perhaps I might not even know today that I am living with that. So since then, I have been an advocate for people who live with narcolepsy. I have a group where I support others who are living with narcolepsy and share factual information with them. And I'm very lucky that I have an IT background and I'm a previous federal government employee. And so my ability to find resources that are factual is very good. And I'm able to share that information with the group members. But there's just so much mis and disinformation out there. And I am also a member of lots of Facebook groups because I am actively commenting on posts where people are sharing myths and disinformation, because it's so important that the right information is out there. I'm looking forward to hearing your questions today. And yeah, I hope that you find something very useful out of this and learn a bit more about the subject, because it really is vital that we learn how to tell the difference between the fact from the fiction.
Fantastic. Thanks so much, Di. Let's send Di some love. So here's a chance for you to use your reactions. Go for it. Yay. Hope you're feeling the love there, Di. And
Absolutely.
fantastic. It's just a really nice way to know that someone's heard you and they appreciate what you've said. And it was really great to hear your story too. And we'll be coming back to Di a few times again today as we go through the presentations. But now we'll be moving to our next presentation, Professor Jason Kovacic, who is the Director and CEO of the Victor Chang Cardiac Research Institute, as well as a cardiologist.
Thank you. Thanks everyone for tuning in to listen to this. I think it's a really important topic. So yeah, I'm a medical researcher. I'm the Chief Executive Officer and the CEO of the Victor Chang Cardiac Research Institute. I'm a practicing cardiologist. And social media in general was never, ever a part of my career plan. And it's really something that has grown upon me and my institute somewhat organically, but somewhat out of a really perceived need for us to be doing this. And I came into the role as the CEO and director of the Victor Chang Institute in 2020, right at the very beginnings of COVID. And as you may remember, there was a lot in the media about COVID vaccinations, a lot of mis and disinformation around COVID vaccinations. And I'm sure there'll be divergent opinions on the people on this today about COVID vaccinations. But nevertheless, I think we probably all agree there was a lot of mis and disinformation from both sides. And included in some of that was the potential cardiac complications of the COVID vaccines. And the hard facts were that the COVID virus itself caused many more cardiac problems than the vaccines did. Now, the vaccines did cause cardiac problems. There's no argument or discussion about that, but the virus outdid the vaccine about 10 to 1 in terms of cardiac problems. So this was a really important message at the time. And but boy, did it cause a lot of backlash, and I really learned an incredible amount about misinformation, disinformation. I'm not exaggerating to say I got death threats during all of that for some of the things we said, which remain to this day. It was just an honest portrayal of the facts that were emerging about vaccines at the time. So that was really a sort of a necessary thing we did. But as COVID has passed and we've moved on, looking at the landscape and really thinking about what's going on, it's so obvious that there's far more subtle, particularly in medical research context, misinformation that's out there. And that relates to all sorts of things that might seem as benign as protein supplements, electrolyte drinks, and so on. And it goes right up to all of these longevity movements that are going on. People, spending thousands of dollars on ice baths and home hyperbaric therapy and these different things that a sort of somewhat nuanced levels of misinformation. And I think protein supplements is a good thing. I mean, if you look now, you can buy protein enriched water. I mean, we actually get plenty, adequate amounts of protein in our diet. And having a healthy, balanced diet is a far better way to not only receive the right amount of protein, but also vitamins and minerals and fiber and so on. We just don't need these supplements and to be paying enormous amounts of money. And I think another area is sports drinks and electrolytes. For most of us that are doing regular exercise, and you should all be doing 150 minutes at least of moderate intensity aerobic exercise a week. But for those of us that are doing that, we don't need to be taking electrolyte sports replacements and so on. Now, certainly if you're an Olympic athlete, you're doing, more than an hour and you're sweating a lot, then it's something to consider. But I think this pervasive media and marketing campaign that we all need to be taking all of these supplements and electrolytes and so on is nuanced misinformation. And so I think it really is pervasive across our society. So I've been doing a lot of this stuff because at the end of the day, as running a medical research institute, our core mission is to save lives and prevent deaths of cardiovascular disease. And if I can achieve that, or we can achieve that through our messaging and public messaging and media, as well as doing our basic research mission, then that's a positive and that's a win for the country. So that's why we've been doing more and more and more of this media and dispelling mis and disinformation. We focus on two main channels, both traditional media, so that's predominantly print and radio, but also increasingly social media. So I've actually made a lot of videos on social media talking about some things about what's a healthy diet, what should I be doing, how much alcohol can I drink, but other things like dispelling myths. For example, the carnivore diet, I think, is another great example of misinformation. The carnivore diet is just, people wanting to get out there and just eat red meat most meals of the week. That comes with a huge load of saturated fat, which is just not good for our health. So dispelling these myths is really important. And as I said, if it, in the end of the day, can save lives from cardiovascular disease, that's what we're all about, and that's what we do. I would say, particularly on social media, a lot of the commentary is negative. And as I said, as an extreme example, I got death threats at the time of COVID about some of the comments of the facts we tried to lay out about vaccinations. But nevertheless, even saying something like, eating too much red meat and red meat 1 or 2 meals a day is not good for your health, those kind of comments from me have also got backlash. So I really don't care too much about the backlash. I think our job is to just put the facts forward and let people be their own judge and not be swayed when that happens. But I think it is an important element for us to consider today that as we try to dispel these myths, we inevitably upset people. But I think, in many ways it's our job to do that, and we can't be dissuaded from the truth because people get upset. So I'm looking forward to the interaction today, to taking some further questions and to having this discussion. So thank you all again for listening in and participating in this important webinar.
Fantastic. Thanks so much. And you're getting the love. I hope you can see that, Jason.
I
Lots of
can.
love
Thank
arriving
you.
your way already.
Thank you.
So important to hear from you and the things you're doing every day. And I'm going to throw to you now, Di, and just ask you what stood out for you with Jason's presentation.
I'm joining it. Here I am. What stood out? Because I too get attacked on social media when I correct people's information. Definitely. Yeah, people really, when they're trying to protect their agenda, especially if it's, a product or something that they're trying to convince people that this is going to cure you. Yeah, they really, really do get quite nasty, but I don't care. Like Jason, I don't care. It's more important to me that I'm sharing the correct information so that people do have that out there available to them.
Yeah, great, thanks. And Isabel, you've asked a question, and we'll hold that over for the panel later, but just for the two people like Di and Jason to think about. Isabel's question is really about, is there no such thing as bad PR, right? If you start talking about one of these issues, does it actually drive it to be better known about and understood? So let's think about that, and we'll come back to it in our conversation. I think it's a really good question, Isabel, and I'd love some more questions. So send them on, because at the end we're going to have a really lively conversation. If you've got questions, and look, there we go, we've got another one. Yeah, how do you decide when to engage or not engage? And I was even thinking, like, what are the key success factors for mis or disinformation? Like, what makes it thrive and what kills it? What can we do to help kill stuff? It's a bit like weed killer, I suppose. And what do people do to sell things to you? So let's come back to that later on, because we're now going to have our second presentation from Dr. Brooke Nicol. So Brooke's a National Medical Health and Research Council in their Emerging Leaders Research Program. And we put her bio in the chat as well. And Brooke is really deeply into this topic as well. And she's going to talk to us about the research she's led and published, which looked at particularly social media and misleading medical marketing, as it says on the slide, in social media. So over to you. Thanks so much, Brooke.
Everyone can hear me all right? Is that working?
Yep, all good.
Great. Okay, perfect. Well, thanks so much for the introduction and for inviting me. Yeah, I'm really looking forward to this. As it was said, I have been doing some research on this topic now for a number of years. So my presentation is a little bit different to Jason's, in that I'm going to be going through some of the findings that we have and maybe try and help give some potential solutions as well. So we'll get going. And so, as mentioned, I'm from the University of Sydney. And I really work across these two research groups. The first one is called the Sydney Health Literacy Lab. And the vision of our lab is to create a healthcare environment where health information is clear, evidence-based, accessible, and actionable for all. And I also work with a group called Wiser Healthcare. And the mission of Wiser Healthcare is to conduct research that will reduce overdiagnosis and overtreatment in Australia and around the world. And my really particular area of focus is on providing evidence-based information for consumers so that they can make the right decisions that are aligned with their health and reduce this kind of low-value care that's related to the topics of overdiagnosis and overtreatment. So not a surprise to everyone here probably now, but over the last decade or so, social media has really emerged as an important space for commercial marketing of both health and medical products. And this has been done through traditional advertising, but also through partnerships with social media influencers who have a financial, or as we've discussed previously with Jason, some sort of vested or brand interest, which is also usually then tied back to being financially linked. And now, again, it's probably quite well known that misleading information, which includes both these topics of misinformation and disinformation on social media, exists and is quite well spread. Following on from COVID, like Jason said, this has become even more prominent and kind of really took off during that time. And there is now evidence that up to 87% of social media posts about health are misleading. And in terms of regulations in this space, well, it's a little bit like the wild, wild west. And I'll talk a little bit more about that, but it's really difficult to regulate some of this information. And that, I think, is where some of the crux of this problem lies, is that it's really hard to regulate. So it is out there for consumers to engage with. And so for someone like me who works in this area of evidence-based communication and also being interested in low-value care, like I mentioned, I was really interested seeing what was being discussed and promoted on social media around tests, treatments, and other products that have no evidence of benefit. I will fully declare that I'm not an avid Facebook or Instagram or TikTok user. I didn't even have any of those accounts other than Facebook before getting into these studies. So I was no expert on what was happening on social media. I was just really interested on how things were being discussed, around these areas that we know have no evidence of benefit, and why were they being discussed, and how could we potentially kind of stop that? So I guess I went out to try and better understand this with the first study that I'll be discussing. And now I'm just going to give a little pre-warning about the next slide for everyone. This is a post about an influencer. And yeah, I hope it doesn't cause anyone any distress by seeing any of this. But really, before I begin into the work I will be discussing, I just wanted to share this picture here. And so this guy, he's not only a social media influencer with hundreds of thousands of followers on Instagram and TikTok, but he's also a medical doctor. So I just really wanted you to keep this in mind as much as you kind of can tolerably can as I go through the rest of my presentation. So the first study we conducted was published last year and was looking into medical tests with potential for overdiagnosis and overuse. And these tests were really being heavily discussed and promoted on both Instagram and TikTok. They were really, really kind of popular emerging tests that were being discussed. We looked at 1,000 posts across these 5 medical tests, and we knew these tests specifically had no evidence of benefit for healthy people, but were being discussed and promoted to them, and essentially being trying to be sold to them. And so the 5 tests that we included were the full body MRI scans. And so those were being promoted to healthy people when we know they have no evidence of benefit for them, can find abnormalities that can be inconsequential. We also looked at the multi-cancer early detection blood test, which is really still in its early phases, and the data is still really limited. And again, for healthy people at this time, the evidence does not say that it has any benefit over the potential harms. We looked at the anti-Müllerian hormone test, which was being promoted as this kind of so-called fertility test to young women to kind of test and see what their potential fertility could be, when we know it is specifically not recommended for women outside of an IVF setting. We looked at the gut microbiome test, again, has really good potential science for many specific areas, but in terms of healthy people, the evidence is not yet there to outweigh, for the benefits to outweigh the harms. And we also looked at testosterone testing being promoted to healthy men, again, where there's no evidence of benefits and some real potential harms for individuals taking that when it's not medically needed, or taking testosterone therapy, I should say, when it's not medically needed. So in the end, with our study, we had 982 posts, and these were posts about these 5 tests that were posted between 2015 and 2024. Most were closer to kind of 2023 and 2024, but there were a few outliers. They're from influencers and account holders with a combined of almost 200 million followers, that 15 or almost 16% of them were medical doctors. And what we found is that 87% of the posts mentioned potential benefits of these tests, well, less than 15% mentioned potential harms, and only a small proportion mentioned overdiagnosis specifically. We also found that almost 84% of them had an overall promotional tone. Only 6% included any mention of evidence. About a third used anecdotes, so kind of personal stories. Around 50% really strongly encouraged the viewer to get tested and had some sort of link or way that they could go and buy this kind of test. And then almost 70% had an explicit financial interest. And just in terms of that, I wanted to make it clear that we only looked for those explicit financial interests. So people who were directly linked with the company or said, buy the test here, or declared they were getting a discount, or that it was an ad or something like that. We think that's a vast underestimate, but we didn't kind of, follow the money trail too deep beyond what they were putting out there explicitly. And so this is just a quick graph here to kind of show those. You can see that very overarchingly mentioned benefits, overarchingly promotional, and very little mention around harms. Again, very little evidence and quite a few financial interests involved. And so there was this really underlying theme, and I think it kind of alludes to what Jason was saying around kind of this wellness industry. almost kind of coming into the health and medical space and using social media as a way to do that, because there was this really underlying theme that we found around this idea of living your best life. So, knowledge and empowerment through getting screened and getting tested using these specific interventions. And when these interventions lack evidence of benefit, I think that's a really dangerous and misleading thing to be promoting, in a really dangerous and misleading tone to be giving to consumers, that if they go and they spend the money on these things, that they will kind of live this better life and be healthier and happier. And unfortunately, you can't see my pictures there, but they're just some of the pictures of the influencers that were promoting these tests. And they were everything from kind of the everyday girl next door to various medical doctors. So kind of everyone in between discussing these things. And they were using some quotes, like I said, that had this kind of underlying tones of living your best life. You can read them here around these different tests, saying, things like, you deserve to be healthy, you need to empower yourself, knowledge is really important. If you kind of got these mild symptoms that we're all struggling with, that's not good enough. You need to be healthier and you need to get on top of your health in these ways to kind of live these happy, vibrant lives. Kind of using these almost fear-mongering tactics to get people to engage with these sorts of different tests. And again, I think, being empowered about your health is so great in so many ways, but when it is being misleadingly discussed and promoted for some kind of financial or personal gain to these influencers, companies, or doctors, I think that is really, really dangerous and a really big issue for the public. So we actually did a kind of more deep dive into one of the tests, the testosterone tests, where we did a more in-depth qualitative analysis of what was going on in terms of some of those themes. And what we found in that report there was that this idea of low testosterone being a crisis that was threatening male sexuality. We found the rebranding of low testosterone as a young man's issue, kind of linked to this ideal of unrealistic, different muscular bodies for men. There was an emphasis on self-promotion and gym performance, probably unsurprisingly. And there was also this really narrow promotion of these ideals of masculinity. So kind of really sitting in this idea of this topic that you may have heard of before, this societal kind of ideology around the manosphere, and really taking that idea, but showing it as more of an industry in the promotion of these different types of interventions that can be harmful. Off the back of both of those studies as well, we kind of wanted to know what interventions actually existed to address some of this misleading information. So we conducted a scoping review to try and better understand this. And what we found is that most interventions targeted the individual specifically, with only 7% of the peer-reviewed interventions and around 64% of the organizational responses being sensitive to this topic of overdiagnosis and overuse, what we were really specifically interested in. However, we did find that some of the regulations did exist in the area of medical advertising in terms of traditional forms, but they were just not adequate in terms of the protections to deal with this unique setting of social media and influencers and kind of the tricky ways that they are getting around some of these more traditional advertising routes. And I think I'll just click through that. That's what I talked through there. And then this is just one example of a study we're currently working on. We're kind of in the final stages here on some of the other topic areas we're interested in, where these interventions around health and medicine are being promoted and discussed online, and they have no evidence of benefit for healthy people in the public. And like I said, this is just one. We're doing research in other areas, and I'm sure you can all sit there and think of some of other areas that are potentially are also, it could be included in this. And I know Jason also talked about some of those things around, supplements and vitamin waters and some of the wellness products as well. So in this specific one, we're looking at women's health because, I think there's been a lot of a really good, how do I say this, publicity and awareness around women's health issues recently, which is absolutely amazing. But I think some of these influencers and some of these companies are jumping on that kind of strong movement and are kind of taking advantage of it. This is what we're looking at in this study. And like I said, the results are will be coming up soon. And all of this has been in consultation with consumers as well. I should just note consumer researchers in this topic. Now, some potential solutions we're doing now and looking into. Public awareness, I think, is a big one. Again, like Jason said, I think we have to be out there as scientists and doctors and researchers and the public pushing against these claims, these misleading claims. We're looking at an evidence-based social media campaign here at the University of Sydney. I'll show you a little bit more about that in a second, to, again, try to counter some of these misleading claims. And we're also doing a study where we're trying to map current national and international regulations, creating frameworks that can be applied to other medical devices or health areas to really try and prompt some sort of reevaluation of the current frameworks that exist and support policymakers. And this will really identify, the common advertising violations that can potentially help governments enforce these regulations, and also help consumers identify things that can be misleading. So really trying to understand that kind of policy and regulation landscape that I think is really important here, because like Jason said, it's so pervasive and it's so persuasive that we can do everything as individuals to try and counter some of these and have all the skills to do that. But when you see something 4, 5, 6, 7, 8, 9, 10 times, it becomes normalized. And the ways that they're using anecdotes to tell their stories about things, again, there's benefits to that in so many different health conditions and ways, but there's also potential harms or things to be aware of that I think, can really get people persuaded that that's something that they need or something that's going to make their health or life better. So just really quickly, that I'm just showing some of the media work that we've done around some of our studies to try and, again, push that message out there around some of these tests that are being misleadingly marketed. As I said, we're doing this campaign with the University of Sydney. It's very cringe for me to have to pretend to be an influencer. That's not my normal kind of way to be, but I think, like Jason said, it's sometimes needed. So we're trying to push back against some of this. This campaign will be coming up in the next few weeks. So if you follow University of Sydney on any of your channels, keep an eye out for that. And yeah, I guess just circling back to this before I give my last slide and just thinking about, our kind of doctor friend here. And what do you think? Should he really be able to sit there shirtless in a hot tub giving medical advice on tests with no evidence of benefit? I really don't think so, which is, why I think we're all trying to continue doing work in this space to help protect consumers and really try and provide some of these solutions so that people can look for better information and advice online. And just my last slide here, I think I've definitely went over time, but I think this is a really important one, because you might just be sitting there then asking, what can I do? And I think, like I said before, I think it's really tricky to place the responsibility solely on consumers to be able to navigate this information. I don't think that's fair. I think there needs to be stronger regulations out there. I think there needs to be better evidence-based information and more people like Jason providing that information that's from trustworthy sources. But I think, as a consumer and as a public, we can, first of all, be skeptical. And like Elizabeth said, I think we can be curious, and that's a really good thing, but be skeptical. And if health and medical information, especially on social media, sounds too good to be true, it probably is, especially if you can see some clear financial interest involved, if you can see that they're trying to sell something, that they're from a company, there is a bias there. And there is then going to be underlying reasons why they're discussing that or promoting it. I think, though, we can look for balanced information, look for whether they are saying things about benefits, but they potentially are saying harms or caveats that might, be things to think about. That's important for consumers. Make sure it's not particularly emotive. I think that's a tactic that's being used a lot and something to be aware of. Look for evidence, and again, look for credible sources that was discussed earlier. And just lastly, I think if you're, concerned about anything and you're unsure, go back the old-fashioned way and go talk to your GP about what the benefits and harms of that particular thing means for you. Thank you very much.
Fantastic. Thanks. I'm sure people are going to send you some love now, Brooke. We can see that they're coming your way. I did want to ask you, um, in your research, you talked about some potential harms. And one of the things that I was thinking about as you were talking was people are less and less sure about information and whether it's true or not. And what that might mean is they delay getting any kind of treatment. They don't trust their doctor, they don't trust the government, they don't trust the internet. And so then they can potentially get sicker by waiting and being worried about information. Did you see any sense of in any of your work of people saying, I didn't know what to trust, so I didn't do anything at all?
Yeah, I definitely think that it has come up. It's not specifically the area that we've looked into, but I know that others have looked into that. And I think it is a movement that we're also seeing. I don't want to go down the political route, but I think there is a kind of a push away from traditional evidence-based medicine and establishments. And I think, that does come up when people have had bad experiences with the health system, and rightfully so. And they turn online for different things. They turn to different communities, and all of those, online communities and other resources can be really helpful for those people. But I think for me, as someone who works in evidence-based medicine, particularly, I think that is where we still need to keep, our trust in, and we need to really believe that doctors are trying to do the best that they can, and that is why they go into that profession. And they won't always get it right, and there will be potential, consequences of that. But I think the evidence is there for a reason, and I think that is kind of where we should have our back hold of the information that we're getting.
Yeah, fantastic. Thank you. I'm going to throw to you in a moment, Di, for your thoughts. But I just do want to give a shout out to Anne, who I think has written an entire PhD, a second PhD in the chat. Thank you, Anne. I think we need to send some love Anne's way because she's been so busy in the chat. And those of you that haven't put your questions in, you better get in because we've got quite a few already in there. We've got, in a moment, we're going to start asking those questions. And now's your chance to put in your thoughts. But I'm going to throw to you, Di, and ask you, what did Brooke's conversation bring up for you?
Oh gosh, so much. Yeah, look, with the influencers and everything, they're everywhere. And there's so many of these fake accounts as well. Like you see celebrities such as, gosh, for example, one I saw a couple of months ago, I think it was Guy Sebastian suggesting blah, 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 blah. And it actually looks on the outside, it looks like it's really him. And it's really him sharing this information. But when you start to actually look into that account itself, then you find where they come undone because they don't have all the background information that supports that it is actually that person. But so many people aren't as literate when it comes to these things, so they take these things on face value, which is just so scary. The fact that people are potentially not seeking advice from a medical professional because they're choosing instead to believe these influencers and then trying these other products that they're selling is just so alarming, and we really have to do something about it.
Yeah, thanks, Di. I tell you, when you were talking, Brooke, and also the comments are in the chat, what I was thinking about is when I was younger, when I first learned to shop, my mum taught me when you go to the greengrocer's day, you smell the mangoes and the melons and you squeeze the tomatoes, and that's how you know whether you should buy them or not. So you always check before you buy something. And I almost felt like, what does that squeezing and smelling look like in a virtual world? When someone's offering you something, whether it's health advice or indeed anything, how do you do that really well? Um, so now we're going to start to have a little bit of a chat and look at some of the questions that are there. So I'll get the panelists to all come back up, thank you, with their videos. Fantastic. And let's start with a question that was asked early on, the one that I spoke to Di and Jason about at the beginning. So I'll go to you first and then to you, Brooke, on that same issue, which is, what do you say to the theory that myth busting just perpetuates the myth or even explodes its reach? So I'm going to go to you first, Jason, then I'm going to come across to you, Di, and then Brooke. in trying to dispel myths, do we actually make things worse? So we better just leave them alone and hope they die a natural death. What do you think, Jason?
It's an important question, and I think it depends on how you engage these myths. And if we're, sensationalist in the way we engage the myths, and just if we're trying to sort of just self-promote by tackling myths, then sure, that's I think the potential negative consequences that we perpetuate these myths and they just bounce around. But I think if you're, calm, it's cool, and it's just a direct message, and we're not sensationalizing things. And I think that's really important to have that counter message, the truth, actually out there, so people can, at minimum, the information is out there and people can actually look at it and judge for themselves. But certainly, sensationalizing things and playing off those kind of influences that Brooke was showing is not the way to go.
Great, thanks. Di, what do you think?
Absolutely, I agree with Jason. Staying calm, and then perhaps sharing factual information from reliable resources as well, just to back up what you're saying, can also help to show that perhaps they're not quite right in what they're saying.
Great, thank you. Thanks. Brooke, what do you think?
Yeah, no, I agree with Jason. I think it needs to be out there for consumers to engage with and have that evidence-based information. I think there is some research that's been done on this and shows that, people who are always going to believe something, they're always going to believe that. You can, give them all the good evidence and all the good tools and all that kind of stuff, and that they'll never be persuaded. And it can actually, like we've seen it from vaccine kind of space, is that it can actually like fire them up and make their campaign or their views almost stronger. But that is it's a minority of people. And then there's kind of the middle group of people who can be kind of persuaded to one group or the other. And then there's the kind of other group. So I think it's that middle group that you need that evidence and those facts out there to be able to then kind of convince them and push them in that right direction and get counter really just all the other noise.
Great, thank you. Thank you. Now, there are a few questions about what do we do? So we might tackle that because you've got, 70 odd people on the line here that are keen to actually join the movement and help, right? They're asking questions about what's the best way at a micro level. So what do? I don't know, family group chat, someone says something, how do I deal with that? Versus what can I add to kind of more structural changes? So let's look at these lenses differently. I'm going to start this time with you, Di, and then I'll go to Brooke and then across to Jason. Okay, so let's start with the micro. What is some, one or two tips for people who, whether it's on their Facebook feed or, they're waiting to pick the kids up from after school or whatever, and someone says something and it raises your eyebrows or even gets your guts churning, depending on what it is. What's your advice? What can people do?
Don't react. Stop and think first. It's so easy to become quite passionate about things and get angry and go, no, and react that way. You really have to think about it. So maybe you might have to wait until you get home from picking up the kids first, and then think about what you're writing. I often use notes. I'm an iPhone user, so I use notes to write things out first, and then I'll go read it back. And if I'm still not sure, I'll leave it there and then I'll come back later, reread it. Yep, I still agree with this, and then I'll share it.
Great, thanks. Brooke, what are your tips?
Yeah, same tip. I think don't react. I think going to look for credible sources, and really, empowering yourself with good evidence and good information. Off the back of that, I think you preluded to this question before, but I think, if you see something online and commenting on it, that those comments or those, discussion actually then push the post to become more viral. So if you see something that is bad, you can report it on social media. You don't engage, swipe as fast as you can. The more you watch it and the more it will feed you that, and the more it'll feed other people that. So I think not engaging with those sorts of things online, and really just taking a moment to stop and think and being critical about what that information means in general. Why are people saying it? But really what it means for you and your kind of health.
Great. Jason, what do you think?
No, absolutely. I agree with all of that. I mean, we would almost never put something out in a knee-jerk way. And I do exactly what Di does. I will write some kind of response and then save it and then go home and sleep and then look at it the next day. And some of the time I'll just flat out delete it and say, no, I'm not going to even engage in that one, because it's just too, misaligned, or there's too much malintent, or for all the wrong reasons. But no, if it's just a matter of correcting some facts, then we'll often put out a statement. And I also think you're talking about the micro and the immediate things. Uh, I think in terms of correcting messaging, it starts within our own families. And I spend a lot of time with my kids, talking to them. My kids, I let 13-year-old kid, I let my boy, he wanted to cook a steak, and this is about 2 weeks ago, and he starts cooking steak, and he gets a whole like quarter kilogram of butter and tosses this butter. And I'm like, what are you doing? He says, oh, this is how this carnivore guy cooks steak on YouTube. You are not eating that steak, my boy. And but
He's got the wrong dad for that one, right?
but it's amazing. He wanted to like deep fry the steak essentially. And it was, and he showed me this YouTube, and it's influencer looked exactly like that guy Brooke showed us in the hot tub. It's pervasive. And so I think it starts with correcting these myths and this misinformation in the home, and then, spreading out from there.
And like I said, giving the kids the skills, looking through that with them and explaining. I'd add one, which is a lot of social media, you can actually say you're not interested in things. So if something comes up on your Instagram, I agree, don't leave it there long, Brooke. Go straight down, click on the buttons, go down and say, not interested, not interested. Boring, don't like. You can hide reels on Facebook. A lot of them have a way of helping you shape your Instagram. The more you say, report it. If you think it's no good, report it. Then that's also a way of shaping at least what comes to your mind and what is in your feed. So that's another micro way. Now I want to look at the bigger picture. I'm going to start with you, Brooke, then go to Jason, and then to you, Di. What about the bigger picture? So, okay, we're out of the family Barbie now, but now we see something in the newspaper, or we go to a forum, or someone sends us something as an email at work, or we're even thinking just about our own families and situations and thinking we need better guardrails in place. What are the things that people can engage with or even do themselves to help really raise awareness about this?
Yeah, again, it's such a tricky one. I think for us, like when I started, we did that study that I first showed you, and I started getting all this media. And the first thing the media would say to me, of course, was, what can you do? What can people do? And I was always really, I always didn't really know what to say, because I do think there is things that people can do. But like I said in my presentation, I really feel like this is bigger than the individual. And there really needs to be stronger regulations in place to protect consumers from this. It's really difficult in kind of the wellness space. Some of the tests I was discussing, where they're this gray area where they are, they're not regulated by specific different medical bodies. Some of them are legitimate medical tests, but the way they're being discussed and promoted is completely misleading. So for us, I know as I said, we're trying to really understand that and put more pressure on regulators to look into this. I know, if you see something you really don't agree with, you can report it, but it's got to be reported a number of times for it to actually be taken kind of seriously. I think just creating more awareness amongst the groups that you're in, your social circles, but it is really hard for individuals to do lots about these bigger issues, I think, in terms of really, trying to take down these big kind of tech companies or push for stronger regulations. But I think there is a place for everyone to do that. And if you're really concerned about something, then definitely that is one place that you can go and report some of these things to, the ACCC. There is ways and avenues to do that as well.
Great. I'm going to come across to you, Jason, and anyone with any other tips, feel free to put them in the chat too. What are your ideas?
Yeah, no, it's very multifaceted, I think, in ways to combat this, and at an individual level. I agree completely with Brooke that legislation is key, and ensuring at that level that things are reined in. And even the social media ban for less than 15-year-old kids, I think was a step that'll help in this regard. I think it's important for people to choose their sources of information very carefully. And I think this is, if you're on X or Twitter or, then, good luck, because there's so much, stuff out there. But even in the mainstream, I think a lot of these wellness influencers and things, there was one that's I know of well, and I'm sure some of the people on this will know today, of Peter Attia, who was an American wellness influencer, very prominent, um, he spoke a lot in the sort of heart health space a lot of the time. I took a lot of issue with some of the things he said, but it was it's very hard to do much about these prominent people. But the last 3 weeks, he's had a spectacular fall from grace globally, as he was mentioned over 1,700 times in the release of the Epstein files. And I think that really shows you the true character of some of these people that are, dwelling on the fringes of what's appropriate, or probably in this case, well beyond the fringes of what's appropriate. And I think you just need to choose so carefully, because a lot of these people, are just wolf in sheep's clothing.
Yeah, great. Di?
I agree with everything that's been said. And you just need to remember that good health information doesn't promote one treatment over another as well. That's something to bear in mind. Good information gives you a balanced facts based on research. So beware of any dramatic writing or promises of cures and claims that sound a bit too good to be true, because they are. They're not the real thing. Those are signs that they're often a fraud or a scam. And you really just need to evaluate the quality of the information that you're seeing.
Yeah.
Be smart.
So,
Don't take it face value.
yeah, fantastic. Thank you. So, Di, I'm going to keep asking you a question, and then I'll come around the grounds again, because people are asking, and it's in the chat too, what should the government be doing? Do we need legislation, regulation? And somebody, I think it was, I don't know if you say Leela or Layla chat, made a great comment about, if you know it's misinformation, well, you can kind of delete it or ignore it, but maybe you don't realize it's wrong, so you don't know to be curious or be skeptical, because it doesn't worry you when you read it. It makes sense to you. So that means it's not just individuals, as Brooke said, that can fix this. We need a broader fix. And a lot of this is not Australian, it's global. So even what our governments can do to fix things that are being posted in other countries is a whole other question too. Have you thought much about this at all, Di? Then I'm going to come to you, might come to you, Jason, and then Brooke. What do you think our governments should be doing?
Yes, they
And
do need to make legislation, especially around AI, which is fed so much incorrect information. So and depending on how you word your questions when you're asking AI something, is going to be reliant on the result that you get as well. So people need to be aware of that. Look, there's just so much that needs to be done. Hopefully somebody from the government that is involved in all of this is watching, or will watch the replay of this webinar and learn a thing or two, and maybe start looking at addressing some of these needs that we have.
Send some letters to your local MPs and include a link to the
Definitely.
YouTube, right? What do you think, Jason?
No, I agree. I think Brooke's probably the best one to tell us about legislative moves. I know that I think government does have a huge role to play. I think it's a fast moving and fast evolving field. I mean, the AI is moving so fast. Just keeping up with it, let alone ahead of it, is a huge challenge. But I think that's their responsibility. And I'd also say, what are we doing? What am I doing? We're just doubling down on just focusing on getting out quality, simple, factually correct information through as many channels as we can, and not letting up on that. And I think a lot of us are doubling down on that. And one of the challenges, it's not it's just core medical information, which is not that exciting a lot of the time. It doesn't get a lot. It's not clickbait, but we just have to persist with that and make sure that the true facts are out there.
Yeah, great. Brooke?
Yeah, I completely agree. And as Jason said before, it's definitely multi-pronged. And, we're going through kind of the different levels right now, but it's in terms of legislation, like I've alluded to, there definitely needs to be stronger regulations. Australia is really good in terms of the practitioner APRA regulatory body. They have really great legislations and guidelines for Australian health practitioners and what they can say and do on social media. But the really tricky part of, especially in terms of social media, is that you can be sitting there and you can see that shirtless man who's from the US promoting something and calling, he's a doctor, and you can still click on the link and get a direct to consumer test ordered from America, or find links to somewhere in Australia that's doing it. So I think it's really tricky. And what we're finding in the study that we're doing right now, where we're looking at and kind of trying to map these different regulations internationally, is that there are things that exist. There definitely are regulations out there, but so, like Jason said, social media and AI, the regulations can't keep up to what's happening. And influencers and companies are finding tricky loopholes to get around the regulations. And so I think, yeah, we just need to really better understand how they're doing that. And also, I will just say that I do feel like a piece of this is better educating young people from the get-go, and whether that's kind of some some education reform, or I don't know, but this is the world we live in now, where we do need to equip everyone in our society. But can we start from young about how to look, like Leela said, how do we look for good information? How do we critically appraise that? Is a really hard skill to have. And we know that the vast majority of the Australian public has low health literacy. And so how do we build up those skills as well from kind of a more systemic level is kind of a big question and a big area that I think we can look into.
Yeah. Now, I'm going to stick with you for a second, Brooke, then I'm going to go to Jason and come to you, Di, because this is a question particularly about researchers, so I'm going to dump you in it, okay? Because the question is, so there's all this great research, and everyone may well be familiar with this notion that there's so much coming out that clinicians can't read it fast enough and adjust their practice quickly enough too. So that's what the question's about. What should researchers and institutions be doing to make sure that their evidence-based information gets out in plain English quickly to help counter this? How much are our institutions of learning responsible for battling this, and are they doing a good enough job in the way that they're disseminating findings? What do you think, Brooke? I know, but
I'm
saying government should help. So the question is,
but no, I don't think we're doing a good enough job. I don't think so. I think as research academics, we go in, we do the research that we feel very passionate about and that we believe in, and then we publish it, and it very often, most often, stops there. I think we need to be doing a better job of working with the media, putting our messages out there for the public to hear. I think we need to be doing a better job of working with consumer groups to dispel this information, writing plain language fact sheets. I know both the groups, the Sydney Health Literacy Lab that I work in and the Wiser Healthcare, on our website, we have plain language summaries of some fact sheets around information, different decision-making tools that we've worked on. But yeah, the majority of the time we don't do that, which is why actually after I did all that media for our one study, I went to the University of Sydney social media team, and I kind of maybe was wanting to be like Jason. And I said, we need someone out there with a credible voice going against this. I'd just be interested to see how this all works. Actually, I've never done a post like this. Would you guys, want to help me? And they were ecstatic to jump on something like this. And I know we're developing this campaign as kind of a first step to maybe some more myth busting health and medical issues, and we're going to see how it goes. We've tested the campaign material in a randomized control trial, which is really fun and exciting as a researcher to actually say that it's evidence-based, that these posts potentially can do this or do that. And we're going to kind of follow the metrics of the campaign to then kind of better understand who's it reaching, what's it doing, to try to help inform some of these information channels. But no, I don't think at the moment our institutions are kind of doing enough to be those trustworthy sources, and they can do a lot better. And individual researchers definitely as well.
What do you think, Jason?
Yeah, no, I agree with Brooke. I think so I'll reflect a tiny bit and rabbit hole just a wee bit if I can. So when I came into the Victor Chang Institute as a director 6 years ago, I spent some time looking at, the Institute's profile and its reach. And I realized that the Victor Chang Cardiac Research Institute has a very special place in Australia. And it's due to a whole bunch of reasons that range from, the quality of the research. It's, very trusted. Also, the tragic circumstances of Victor Chang's assassination and him being an Australian hero and an Australian legend and all of these different reasons. But the Institute enjoys this really prominent place in Australian society. And after sort of digesting this for a year or so, and through COVID, and we're doing things about vaccine, I actually realized I had almost a social responsibility to take that voice and to use it for the public good. And it would have been a terrible lack of use or misuse of that voice if we didn't do that. So, I found myself very much the unplanned, unwilling sort of spokesperson for the Institute, if you like, but then it morphed into this sort of spokesperson about heart health and what's good and dispelling myths and so on. So yeah, it takes a team. It's a lot of work. There's a whole bunch of behind the scenes of fact checking and we come up with different ideas. I'm involved in everything, nothing. So, I have differing levels of involvement with all the stuff we do, and it's too much for me to manage on my own, but I'm across absolutely everything and nothing goes out without my final approval. And even that role takes a lot of time and a lot of commitment. But yeah, it takes a team and that takes resources. And I think in our position as the Institute, it's a really important thing that we do for the country and even for beyond the country. But yeah, it's a big commitment, but I find it's a critical commitment for us to make, and I sleep well at night knowing that we're doing this.
Great. Di, what do you think about the universities? Should they be doing more?
Absolutely. I'll use an example of what I've about to do. With World Sleep Day coming up next month on the 13th of March. I'm a World Sleep delegate. And this year I've created an information pamphlet, just a two-sided pamphlet that will be distributed to high schools around the country, which gives a brief explanation of the signs to look for in students that maybe they have narcolepsy, because it was very obvious when I look back that I was displaying these signs, and many people in my Living with Narcolepsy in Australia group also have shared the fact that they experienced these symptoms during high school, and we spend so long at school during the day, more than what we get to spend with our own parents. So if the educators are more aware of what narcolepsy is, perhaps that could lead to having that conversation with the parents and then lead to that student being diagnosed sooner. So that's one example. And another is last year for World Narcolepsy Day in September, I released a limited series podcast series, and that was using the lived experience focus, and everybody from sharing one main symptom and how that symptom presented for them, and the signs and everything, and going through to being diagnosed. Mainly because when you read symptoms about something, reading them and then actually understanding what they mean are two completely different things. And when our own specialists don't truly understand narcolepsy, we're really facing an uphill battle. So I felt that it was really important to share the lived experience that way. And the podcast did really well. It's called Waking Up Tired, Narcolepsy Symptoms Explained, if anyone's interested in checking it out. It's free to listen to, no ads, and it's available on all platforms.
Yay. Okay, we're definitely going to get some more hits Maybe put that in the chat too, Di, so people wanting to look at it.
Sure.
Someone's asking, can they get a copy of your pamphlet too? If that's anywhere online, Margaret's asked. Perhaps you could.
It will be online soon, and I'll be sharing it on my Waking Up Tired Facebook page and website as well. So yeah,
Great.
follow
And
me.
if you get that, if you get that detail from Di, we can send it out to you after the presentations too. Now, someone's asked a question about CHF, so I'll answer that one. I get a question, which is about when people come to us with evidence-based concerns that challenge whatever the prevailing narrative is about something, because science changes, right? What does CHF do? So our job as a consumer peak is to listen to information coming from our members, organisations, we've got about 80 of those, and also from individuals. We get data from communities and from individuals and from organisations, lots of it, in lots of different ways. Through things like the chat in a webinar, to formally ethics approved surveys, we run focus groups, all kinds of ways. So our job is not to advocate for any particular position on anything, but actually to hear all of that and then make sure in whenever we have the opportunity through a submission to government or through a funded activity to make sure that we share those views. So it's common for us to say that the community is not homogenous, or sometimes we say community is messy. And that means that everyone won't have the same view, the same experience, and even indeed the same thing might not work for one person in the same way as it does for another. That's why consumers need to be co-designing. That's why we need to listen to community, because there are legitimately different views and different experiences. So in answer to your question, we wouldn't take one view forward, but we would make sure that when we're talking, we're representing to others the importance of engaging strongly with a wide range of community and consumer members, not having one person on a committee and saying, I did the consumer thing. That's what we really push hard for. So we're nearly to the end of our time, folks. We're going to run that poll that we did earlier on today, which asked you about what you thought was more important to tackle kind of mis and disinformational, and just see if based on our conversation, you've stayed in the same spot or you've shifted. So you can vote now. What do you think is the greatest threat to consumers in terms of, health risks and harm? Misinformation, disinformation, or they're about the same? So I'll give you a minute to do that. Maybe you think the same thing now as you did before, which is okay, by the way. Just give you a few more seconds to put your vote in, and then we'll show them up on the screen. Great, thanks. Oh, look at that. Have we had a change, right? Now people are thinking more that they both can be as harmful. That's quite significant. I would say statistically significant, possibly, from about 50% to at least 75%. That's interesting. And we've got another poll for you too, which will pop up, which asks you, has this helped really? It asks about, do you feel more confident in understanding the impact of mis and disinformation because you are here today? Again, just love your quick thoughts. And we'll share that too in a minute or so, just give you a chance. Okay, how do we go with this one? We've got most people. The team can actually see how many people have voted, so they usually wait till most people have voted before they pop the poll back up. So far, only about half of you have voted. Oh, so we're just waiting for a few more people to vote. While you're voting, I am going to start the wrap up, and I'll come back to the results in a moment. I really, first of all, like to thank, oh, there we go, there's our poll. So about half people think they knew a lot more, some a little bit more, others, hopefully enjoyed it but didn't really learn anything they didn't know beforehand. There you go, thank you, that's really helpful to us. I really wanted to thank our speakers, and now I think you need to go crazy with the emojis in the chat. Big thanks to Di for sharing her lived experience and expertise in this area. Also, huge thanks to Jason and Brooke for being here with us today, sharing their own professional involvement in the area. So you're getting a lot of love there, folks. I hope you can see that. We've got another webinar coming up, and this one talks about the social and commercial determinants of health, which relates a little bit to what we've been talking about today. If it's easy enough for you, you can just take a photo of that QR code and so on. But if you don't already subscribe to our newsletter or our socials, we'll be promoting this over the next month or two. So you'll see it again and again. And then we'd encourage you to come along and also bring a friend. We always say bring a friend. Also like to say thank you, and I'd love you to say thank yous to the team at CHF. I'm up here at the front with my little Gengar on my shoulder here, but there's a whole lot of people at the back end checking in with the chat, making sure that the slides work, writing the slides, arranging the speakers. So huge thanks to all of you for all of your work today. We'll leave the Zoom open for a while, so if you want to put any more comments in the chat, feel free. If we didn't get a chance to answer your question, remember they're never wasted. So we will use them in some way or another. So feel free to add a question or add a comment. And otherwise, I'd like to thank you all. Stay safe out there, especially on the net. And we look forward to seeing you at our next event. Thanks, folks. Bye.